Good afternoon, everyone, and welcome to today's webinar. My name is Kathleen Bates, and I'm a program manager here at the Texas School Safety Center, where I oversee the Youth Initiatives programming, which include two of our statewide youth tobacco prevention programs. I'm so pleased that you all are here today. We had a huge response to this training. Over 1,000 have registered, so there'll be quite a few people trickling in all throughout. So again, very happy to have you here. Before we get started, I want to discuss just a few important points. The first being, please use the Q&A box to send any questions or comments to the presenters about any of the content being covered. Because we have so many and the chat box is blowing up and it's so wonderful to hear from all of you, questions can get lost in the chat box. So please use that Q&A box. And at the end of the training, we should have time to go through and answer questions. With so many of you on today, we probably won't get to all of the questions. So we will export those questions, answer them, and then email them back out to everybody. Today's training is also being recorded. So if you would like to watch the recording again or share with a colleague, you will be able to do so. The recording should be available sometime next week, as well as resources. You'll be able to access the slides and important information in those slides with the recording. You'll also receive access to a certificate of attendance. After the webinar is over, we will send out an evaluation link. Fill out the evaluation, let us know how this training was, and then you'll receive access to that certificate so that you can print it. And if you're having any technical difficulties that are following you or throughout the entire time frame or popping up, you can contact Justin with our IT division at that number below, and he'll help you. All right, so here's a webinar overview on some of what I'm going to be discussing very briefly before we get to our featured presenter and featured resource. We'll look at some of the usage rates from the National Youth Tobacco Survey and the popular brands and devices that were identified in that survey. I'll briefly review House Bill 114, kind of take a look at some of the available resources to support the what's going to be needed with the issue of vaping on school campuses. And then that's when we'll also hear from our guest speaker from Stanford University. So let's jump right in. So the data that we look at when we assess youth vaping usage and honestly youth tobacco usage comes from the National Youth Tobacco Survey. And the National Youth Tobacco Survey is facilitated by the CDC and the FDA. They collaborate together to put this national survey on. It provides a wealth of information and a really great snapshot at the usage rates across the entire country. The only downfall is that it's always a year behind. So the data that we're looking at right now is from 2022. Data for 2023 should be available in the coming months, but that's kind of just how public health is. It's always just a little bit behind. But these rates I still think are pretty relevant. I think we have all seen the issues going on in our schools and our communities. So I still think it's relevant information. First, let's take a look at how many youth are actually using a tobacco product. More than 3 million. And the survey, it breaks it down and asks what type of tobacco product youth are using, from e-cigarettes, cigars, cigarettes, smokeless tobacco, hookah, to pipe tobacco. And of course, e-cigarettes, they are the #1 tobacco product being used among our youth at 9%. If we look at the second popular tobacco product being used, it's cigars at 1.9%. So there's this huge difference between vapes and then other more traditional tobacco products. So let's take a look at the information regarding vaping. So more than 2.5 million high school and middle school students are currently using e-cigarettes. That's 14% of high school students, or 2.14 million. And that's 3% of middle school students, or 380,000 middle school students. If we look at the frequency of use, more than 27% are currently using every single day. So that's more than 1 in 4 using every single day. Also, 4 out of 10 youth are using e-cigarettes 20 days out of 30 days. So that is a huge number. That is a lot of young people who are using almost on a daily basis, who clearly have an issue with nicotine and need some serious assistance. If we look at the most commonly used device, it's going to be the disposables. Of the 2.5 million who responded and identified that they use e-cigarettes, 55% said that they use disposables. And I'll show you some examples of the most common disposables that are being used. Followed by disposables were those pre-filled, refillable pods or cartridges. So you could think of things like Juul, and that was at 25%. So another huge leap or gap between disposables and the pre-filled, refillable pods and cartridges. And then also almost 85% use flavored e-cigarettes. But we know this. We know flavors are what's enticing, and that's one of the reasons why youth try vaping in the first place. So some of the most popular flavors among youth are candy, desserts, and other sweets, but the #1 flavor is fruit. So let's take a look at what the top brands were that were identified from the 2022 data. #1 brand was Puff Bar. And so you can see there's a wide variety of different types of Puff Bar on the screen. You have most likely seen these in your school or in your community floating around. Puff Bar, Puff Plus, Puff Max, that was kind of the order of how we saw it come out. And it really just, the whole reasoning of going from Puff Bar to Puff Plus to Puff Max was the nicotine concentration and the amount of puffs. Then they came out with Puff Plus Zero and Puff Ultra Zero. And the difference between those two products and just the regular Puff Bar is the fact that they are now using synthetic nicotine. So the box says that it's tobacco-free nicotine, but it still has nicotine in the product. It's a synthetic nicotine, meaning it's been made in the lab. And it's very concerning because the Puff Ultra Zero has 8,000 puffs. That's a lot of puffs. It's a lot of nicotine concentration. And now Puff Bar is starting to enter into the THC market. And so you see the Puff Delta 8, which is the Grape 8. So that was what was identified from 2022 data. And another 2 slides, I'm going to show you what is probably more popular today that you've been seeing than Puff Bar. But let's look at some of the other popular brands that were identified from the Youth Tobacco Survey. The second most popular brand was Vuse. You've probably seen this in your school or your community. The third most popular was Hyde, followed by Smock. And so Smock is kind of at a lower percentage rate, about 4% identified using that brand because most of their items just aren't available in the United States. So you've probably seen a variety of these floating around, maybe in the school or in your community. But we really need to be on the lookout for quite a few things. The first being Elf Bar. So while the 2022 data identified Puff Bar as the #1 brand, Elf Bar, I believe, will be the #1 brand identified for the 2023 data. The Elf Bar, I personally see it everywhere I go. I've seen it outside the state when I travel across the country. It is very popular right now, along with the Esco Bar. And so the Texas School Safety Center has a youth advisory board. They're called our Say What Teen Ambassadors. And throughout the year, we poll them to see kind of the different types of tobacco or e-cigarette products and brands that they're seeing in their schools and in their community because they're across the state. And so based off of some of the feedback, this is kind of what we've put together that we know we need to be on the lookout for, because what we might see in El Paso hasn't quite hit, East Texas, but it will get there at some point. So Elf Bar and Esco Bar, be on the lookout for those if you haven't already started seeing them. Another e-cigarette to be on the lookout for is actually from Hyde, and it's the one that looks like a water bottle. I remember hearing about this and thinking, what? And now that I see it, it really looks like a water bottle. It fits, it's big enough to fit in the palm of your hand, so it's not very small, but it does look like a legitimate water bottle. So something to be on the lookout for. And both Elf Bar and Hyde are made by Hyde. Another product to be on the lookout for is from Green Smart Living. And if you look at it, it's different. It doesn't look like all of the other types of e-cigarettes that are common among youth. And I think that's because of the company that Green Smart Living is. Green Smart Living is very dedicated to presenting themselves to be passionate about the environment and protecting the environment. If you look at their website, they have like 5 different environmental campaigns that focus on a variety of things. One of them focuses on clean water, so providing clean water to countries who don't have clean water. They have a plant a tree program where if you buy one of their e-cigarettes, they will plant a tree for you. So we know young people are very passionate about the environment and they care about those things. And so I think that's why this is an attractive e-cigarette for young people. And then the e-cigarettes on the far right bottom, those are LED e-cigarettes, and they were popular a few years ago, but we're starting to see a comeback of them again. Another one I want to bring to your attention is called the Highlight. And this is a bit scary. It literally looks like a highlighter. It takes me back to when we first saw Juul, and we thought that Juul was just a USB because you literally plugged it into the laptop and it looked like a USB. And this looks like a highlighter. So it is a bit concerning. And I've got a video here that I'm going to play for you so that you can see how it actually works. Because right now it looks like a regular highlighter, but there is a way for people to actually vape from it.
How it works. When you pull off the fake marker tip, this is where it can be inhaled. When you pull off the lid, it's actually exposure. The packaging even says highlight and has no mention of it being a vape.
So there you go. That's how that works. So we need to have some due diligence in ensuring that we're taking a look at a variety of the things that are in backpacks and whatnot. Unfortunately, we have to do that, but the tobacco companies, they know no bounds. You know, e-cigarette companies, they clearly have no ethics or morals when they're designing their products.
How it works.
Okay, so let's talk about HB 114 very briefly. So if you are unfamiliar with this particular bill, it did pass this year, this legislative session, and it is in relation to the possession, use, or delivery of an e-cigarette that contains either nicotine or THC. And this does go into effect September 1st. And we looked at it and we took the verbiage from the bill and we kind of just reduced it down into the most simplest of language to understand. And what it's stating is if a student is caught either possessing, using, selling, giving, or delivering to another person an e-cigarette, they shall be removed from class and placed in an alternative education program. This is for public schools. And so something else that it talks about is that if the DAEP program is at capacity at the time of placement, then that student can be put in school suspension or ISS for the time being. So that's kind of just the basic of what that verbiage is. But the most concerning part about it in the bill, where it says that educational and support services may be provided to student and the student parents, we believe it should be provided. These young people need help. They need to understand, first and foremost, what it is they are vaping and what they're putting into their body, but they also need to know why. So that means that they need support services to address their addiction. And so what we want to talk about are some of the most important resources that you can implement as educational or even support services for both the student and the student's parent. Something else to note is that we strongly believe that these resources don't wait to implement them when they get to DAEP or ISS. Start implementing them now, because you want to try and prevent these students from winding up in a lot of trouble because they are addicted and they do need the help. So let's take a look at some of those educational and support resources. The Texas School Safety Center has 2 prevention programs, like I mentioned earlier. We have the Community Prevention Program and we have the Say What program. Both programs focus on reducing and preventing underage tobacco usage and through a variety of means. Both programs provide a variety of online training or education online, resources that can be downloaded or can be requested, like physical, tangible items. The difference between the two is that the Say What program really focuses on empowering the youth. It focuses on targeting the young people to educate them about the dangers and the harms of all tobacco products, but really empowering them to share that knowledge that they've gained with their peers and with their community members. So a lot of the content is designed specific to the youth for them to use in the school and community setting. And the wonderful thing about both of these programs is that practically everything that is provided is completely free, no cost for you to use and implement in your school and community settings. I've put the mailing list, how you can contact staff and how you can visit each of these websites. My slides will be available with the recording, and all links are linked to the actual web pages, so you can easily click through and take a look at the websites. And contact us if you have questions on how you can best implement these programs in the school or community setting. We're here for you. We want to be a resource for you. We understand it is not going to be easy. So definitely take advantage of these programs and how we can best help you. There is one particular resource that I wanted to draw attention to from the Say What program, and that's the Escape the Vape training module. We have a variety of online training modules with the Say What program, but the Escape the Vape one, I think, would be an excellent resource. All of our training modules are self-paced. They take maybe 30 minutes to an hour and a half, depending on how quickly the person reads through the content. But it's designed for both youth and adults. It's not just for youth. Adults can learn quite a bit from the information that's been put together in these training modules. The content is engaging. We have educational videos. We interview a variety of experts in a variety of fields. At the end of the module, there's a quiz and you can receive a certificate of completion. So this might be a really great resource to implement in DAEP or ISS with that student, but also just in general, in all classes. It's a great tool to use to help increase that awareness in the school setting. Campus signage is also very important. You want to ensure that you are getting the message out there as to what your campus policy is regarding tobacco usage. Both programs offer campus signage for free, and both programs offer it in Spanish. We have vape-free specific signage, and we also have signage that says tobacco-free property signage. So unfortunately with the vape-free signage, we don't have any of the aluminum signs. We have posters and window clings. So if you're looking for aluminum signs for the parking lot or anything like that, the tobacco-free property signage definitely has those needs. And so you can request this campus signage from staff. The information is down at the bottom of that slide. And again, you'll get these slides and these links will be linked so that you can access these resources. In addition to signage, sometimes having posters up throughout the school is also helpful with and supportive of what the message that you're trying to get across. And so we have some youth-focused posters. Again, these are completely free to request. And those are the educational resources. So let's talk about the supportive resources. How do we support the students who have an addiction, who want to quit? Let's talk about those resources. So UTMD Anderson has partnered with Truth Initiative. And if you haven't heard of Truth Initiative, they are a national organization focused on reducing tobacco usage. And they have their own cessation program called This is Quitting. And MD Anderson basically entered into a contract with Truth Initiative to be able to provide free slots for Texas youth who are 13 to 24 years old to receive free confidential cessation support. It's a text message-based program, so it works very well because we know youth love to text quite a bit and be on their phones. And then also, if you are looking for campaign resources for your school to put up or pass out, you can actually contact the staff at MD Anderson and you can request those materials. So this is a great resource to have in the back of your pocket at any time when a young person comes to you, whether it's after school one day or it's an ISS, and they say, I have a problem and I need help. You can give them this resource. It's very, very helpful. I also like the This is Quitting program because they have a resource for parents. We cannot forget about supporting parents. they need the assistance as well. And so parents have their own code that they can text, and they can get free advice, tips, inspiration, all the things that they need in order to help their child quit vaping. Our own Texas Department of State Health Services has a quit line as well. It's called Yes Quit. It's available for youth and young adults as well. And so that's the phone number that they can call, and they can receive access to free confidential help. And confidential is confidential. No one will know about it. Parents won't know, teachers won't know, you won't know. So another parental support service that's, I think, critical is the Parents Against Vaping E-Cigarettes organization. They're a national advocacy and educational organization that was actually founded by a group of moms after they found out that their child's school allowed representatives from Juul to go in and talk about their product and promote their product. They're very upset moms, rightfully so. And so now this program is powered by parent volunteers. So it's a parent organization for parents. It is a fantastic resource to share with your parents. There are so many resources, toolkits, podcasts, online trainings. If you're looking to provide some type of educational presentation to parents, they can also do that for you. So a wonderful resource to connect yourself with and figure out how you can incorporate it into those students who do get caught, but also just into the general school community as well. Okay, so on to our featured resource for the day. It comes from Stanford University School of Medicine at their REACH lab. I'm very excited to be able to introduce this particular resource. They have some incredible curriculum available that not only address nicotine usage, but also marijuana usage. And so I'm very much looking forward to hearing from Scott about what he's going to discuss. And so let me introduce him very quickly before I pass it off to him. For over 30 years, Scott has been an educator and involved in tobacco prevention efforts in California. He's been a certified classroom teacher for both elementary and secondary levels, a student services coordinator in the San Ramon Valley Unified School District in California, serving over 34,000 students, and a director at the Alameda County Office of Education, where he led schools, districts, and countywide programs around health and wellness topics, including tobacco and cannabis prevention. In 2022, he joined the REACH Lab team at Stanford University School of Medicine, where he continues his work to empower and educate communities to combat the triangulum of tobacco, vaping, and cannabis. His work at Stanford centers around improving health and wellness literacy and lifting the youth voice while decreasing health disparities and health inequities. A few fun facts about Scott. He has deep roots in Texas and in Texas education. His grandfather, Max Hotchman, founded Academy Super Surplus in San Antonio in 1938, but most of you know it as Academy Sporting Goods. It's pretty crazy. His uncle, Arthur Hotchman, filed a class action suit that went all the way to the Supreme Court on behalf of San Antonio school children, directly challenging the inequality of education funding in Texas. Arthur argued that quality education, not merely basic schooling, was a constitutional right, and the district court agreed. So wonderful to have you, Scott. So glad you're here. I'll pass it off to you.
Well, thank you so much, Kathleen, and I am very thankful to be here today and to be engaging with all of you. And yes, I spent almost every summer from when I was around 9 years old until I was 16, working in the back rooms at Academy all around Austin, and spent a lot of those years also in Galveston, where my father was from and my mom was from Austin. So have some very deep roots and many, many family members all around Texas still. So glad to be connecting with all of you. Happy to share our resources. And for me, my background really is around health education, health disparities, and health inequities, and recognizing the fact that both physical and mental health, we get lots of issues that have come up, and there are tremendous inequities that are out there, and that our young people are being targeted on a daily basis. it's gotten even worse in the 30 years that I've been doing this, because there's been such an increase in social media access, and everything is in their hand now. Filtering has definitely changed how we're able to get information to our young people. So I love what Kathleen has shared. There are tremendous resources that are out there. I'm going to share ours at the Stanford Reach Lab, but I also support a lot of what was mentioned from PAVE, from the Truth Initiative, the work, the Say What work. I used to train in my last job. I would train 800 to 900 middle school and high school students to be peer educators every year. I actually used our Stanford toolkits and our resources here. I would train the students up, and I train the high school students to go and present to middle school students, and the middle school students to go and present to the elementary students. So I appreciate the Say What component of this. And I also recognize that finding alternatives to suspension and or educational supports for young people rather than sending them away from school is something we need to continue to focus on and do. So I'm going to share a little bit about our lab and a little bit about what we do. I'm also going to say that as we jump into this, none of the resources that we provide or that we use at the Reach Lab, none of them include any scare tactics. There's no blame or shame involved. These, when having conversations with educators, with students, with families, definitely avoiding telling them that they're bad or that they're the problem. It's really trying to support them and educate them. So I'm going to share some of our resources. As I go through these, the slides, just so you know, I've sent a PDF copy to Kathleen, so she'll be getting that out to you once the recording is settled here. So you'll get a copy of my slides as well. There will be a QR code at the end. So if you want to get an email directly from me, you'll have the opportunity to fill out that QR code at the end. But the Reach Lab at Stanford really is designed around developing and researching curriculum around health and wellness topics that work with young people, specifically in that kindergarten through 12th grade range. So within our lab, we have, as you can see kind of on the screen, the top two pieces are our tobacco prevention toolkit and our cannabis prevention and awareness toolkit. And within each of those, we have specific curriculum, and I'll dive into that in a little bit. But top is kind of what I would consider to be tier one resources, where I could provide those to the general student population in elementary, middle, or high school. The lessons are all age appropriate, developmentally appropriate. So we've got those for the elementary, for middle and high school, for You and Me Together Vape Free, and for our Smart Talk Cannabis curriculum. The next level is talking about Safety First, which is our harm reduction, comprehensive drug education curriculum. I'll go into that a little bit more. And then one of the pieces that I think ties most closely with HB 114 is our Healthy Futures curriculum. And again, I'll explain a little bit more about that, but the Healthy Futures curriculum is really intended to be an educational intervention and support for young people who you might find on campus with traditional tobacco product, vape. And again, looking at the products that Kathleen shared earlier, they change faster than we can update this slide deck today. I guarantee you that Elf bars, which I see a ton of, and some of the other products that are out there, we've just started the new school year. I guarantee you, if I went to an assistant principal or administrator on campus and say, what have you acquired so far this school year? There'd be products that I haven't seen yet because they came out over the summer. So we'll talk about Healthy Futures. And then the one other piece that I will share is that we have a new data dashboard, and I'll share a little bit about that in the presentation. But that's really data collection and knowing who has received primary prevention education, who's received intervention supports, etc., can be challenging sometimes, especially when you're trying to report to funding sources or to schools or school districts to let them know how many people were served. And we have a pre and a post survey embedded in all of our resources, which allows the educators to be able to see how many students they've served. So in this top line, these are our two primary prevention, education, and awareness curriculum. So You and Me Together Vape Free, we have a 2-lesson elementary curriculum that's meant for 3rd, 4th, 5th grade. We have a 6-lesson, 50 minutes per lesson, 6 lessons for the You and Me Together Vape Free at the middle school and high school level. The 6th lesson in that is optional. It's a cannabis one. So the first 5 are related to vaping and tobacco or nicotine or synthetics. The 6th one in that You and Me Together is specifically about cannabis. And then the Smart Talk curriculum that we have another 2-lesson elementary version and a 5-lesson middle school and a 5-lesson high school. I will point out all of our resources and all of our trainings from the Reach Lab are all free. There's no cost to any of the resources, interventions, etc. There's no expense to you. There's no cost. So I know that there's a number of programs out there, and I used many of them when I was at a school site, district, and county level, and I still continue to support them. But I did want to point out that all of our resources and trainings are free. The next level down is Safety First. And this is something that is new to our team here at the Reach Lab. It's a comprehensive drug education curriculum, really focused around harm reduction, meaning that we know that there are some young people in each of our classrooms who have already started to engage, and really just trying to give them the language and make sure the curriculum doesn't, again, scare, blame, or shame them. But it's a comprehensive, so it includes opioids, it includes things for alcohol, it includes psychedelics. So there's a lot of different components to that curriculum. And then the last piece on here is our Healthy Futures. And there's 2 versions of that, and I'll walk through it a little bit. But the Healthy Futures curriculum, there's a My Healthy Futures curriculum that's a self-paced, about 40 to 60-minute lesson, depending upon how it takes the student to complete. But this is something that a student can be provided a laptop or something at the school site or a computer that they can access. They can take the 40 to 60-minute course. It's really rooted in both harm reduction as well as motivational interviewing and some other components to it. But there's a My Healthy Futures, which is self-paced. Student gets assigned to that. And then we also have one that's called Our Healthy Futures. And Our Healthy Futures is more of a group setting. So it's 2 to 4 sessions, whether it's lunchtime or after school or Saturday or whenever you're doing your group interventions. We have Our Healthy Futures, which is the group intervention. And the My Healthy Futures, there's a tobacco nicotine specific self-paced lesson. There's also a cannabis specific self-paced lesson. So whether the student is needing an intervention based on nicotine or tobacco or cannabis, there are specific My Healthy Futures lessons for that. And again, at the end of that lesson, the student does the post survey when they complete the My Healthy Futures lesson, and then they will receive a certificate of completion that they can provide to whoever administered that intervention with them, as well as it ending up on a dashboard for the administrator and or the teacher to be able to see that the student has completed the intervention. As I mentioned, this is not the QR code that's on the screen right now. This is the one if you want to register to be able to have your own data dashboard if you're going to use any of our curriculum. One of the nice features with the curriculum is that regardless of if you're using You and Me Together Vape Free, Smart Talk, Safety First, or Healthy Futures, if you're using any of them, it is the same login process and the exact same dashboard. You have one dashboard that you will have as an educator, administrator, community-based partner, one dashboard where all of your data will roll up into. And so with all of our curriculum, the URL that's at the bottom where it says reach-teach, that's what you would go to in order to register. We have 100,000 plus schools in the United States that are part of the drop-down list when you go to register as someone as an educator for this or administrator. So hopefully your school is in there. If you're at a public or private school, you can definitely add your school to or schools to the list. And we would gladly include those as well. And sort of the last piece for me is just saying how much I really do appreciate the interventions and supports, the engagement, the youth voice and agency. Within our curriculum, one of the things that I didn't say, but I think is important because it ties back to something Kathleen said about environmental components, and that many young people are really interested or passionate about environmental issues. One of the things within our curriculum is that each lesson is designed with some hands-on opportunities, some Kahoot games and other activities, but there's also specific lessons that tie to things like mental health, that tie to environmental impact and issues, because even though they say disposable on the packaging, what they really are is single-use products, and they're very difficult to dispose of in most states because there's an e-device mixed with a nicotine or toxic component, and you can't just throw those in the garbage can, unfortunately, and you can't separate them, unlike some of the reusables that have a pod. And not that I would promote either way, but the pod and the E part can be separated, but the disposable single use can't. So we have lessons about that. We have components around the targeting, which a lot of the young people really pay attention to, is the fact that they don't like to be manipulated. And so we talk a lot about how different priority populations are targeted by tobacco, vaping, cannabis industries to say, you don't feel like you're part of the mainstream. We'll help you feel like part of the mainstream. Join our team vape or team cannabis or whatever that is. And so there are a lot of times within our lessons, we have information and resources about that as well to really try and help young people and meet them where they are. So those are some of the pieces. If you want to scan the QR code that's on the screen, I actually see that some of you are doing that right now because I just got 30 emails that popped up on my screen. So if you do that and complete the little, put your name and email in there, I will respond to you later today and share some of our additional resources with you. So I'm going to pass it back to Kathleen. I'm going to stop my screen share.
Thanks, Scott.
All right. And I'll pass it back to you. And if there are any questions about Academy or no, we won't talk about Academy now, but I'm happy to be here and answer any questions.
We do have quite a few questions. And Jennifer Steele, who is an associate director at the Texas School Safety Center, she's the associate director over the Tobacco Prevention and Enforcement Division. She has also joined for the Q&A session to help answer some questions as well. So we have quite a few questions. First off, I want to address, there are a lot of questions asking the same thing, and that is, will slides be available after the webinar? Yes, slides, my slides, Scott's slides, everything will be available after the webinar. The webinar recording will be available next week, and that's when we will also have those resources available for you. We will also include a direct link to the verbiage for House Bill 114. I saw that was a question. And we've also put together a tobacco prevention resource directory that has even more resources than what you saw today. So you all will receive a plethora of resources and support services. Okay, so I'm going to answer Julia's question first because she was specifically asking for the QR code. I think you had shared a QR code in the beginning, Scott. would you mind putting that back up on screen so people can access that for a moment?
And I'll drop the link into the chat as well. Just that'll make it easier for people to just click on the link, hopefully.
Okay, great. And then while you do that, there's another question for you. Does your program offer a parent or family component?
That's a great question. We do have family components, and we do have, as you go to our website, and I will, for those folks who fill out the QR code and click on that, I'll make sure I send those out to folks. I'll also send, Kathleen, I'll send you and Jennifer all of the links to the parent guardian information as well. And if there's any folks that are on that are community-based partners, we have resources for community-based partners as well.
Okay, great. Okay, so Sonia had asked what classes are typically used for the curriculum. I'm not sure if you know what she means by that, or if we need a little bit more information from you, Sonia.
I can jump in and then Sonia can see if there's follow-up to it. So for us, every school district, and I'm happen to be in California right now, but every school and school district is different and unique. So we do have some places where there's a health education requirement for all ninth graders that need to take it. So we see it in the ninth grade health class. Sometimes we'll see it in a science class. Sometimes we'll see it in a life skills class. Sometimes we'll see it in the science or language arts class, because some of the Common Core language arts standards are addressed when students are doing meaningful research. And so there's different ways that teachers and schools connect it. So there is nothing consistent. I would love it if every student in middle school and high school had some kind of health education class, but that does not exist. So it does go across the board as far as where people get that information.
There's a question in the chat I want to ask before it gets lost. Marlene is asking if we offer any resources for Spanish-speaking students and parents. And the Say What program does have a variety of downloadable resources that are in Spanish. We even have PowerPoint presentations that school nurses or teachers can provide in Spanish. But Scott, do you all have anything like that?
Yeah, so the You and Me Together Vape Free is currently being translated into Spanish, as is, and our Youth Advisory Board or Youth Action Board students are doing the final review of that right now. So our You and Me Together and our Smart Talk Cannabis will both, within the next 3 weeks, will both be in Spanish at all of the levels. And the My Healthy Futures, that is, we're hoping to have that before Thanksgiving break in Spanish.
So the next question, I saw, Jennifer, you had already been answering this question. I think it had come up in a coined in a variety of ways. And so it says, I work with a lot of schools, and the big confusion, as I understand, is that if they catch a student, they must immediately be sent to DAEP program, as opposed to following a tiered disciplinary approach. Is that correct? Or do schools have the authority to create their own disciplinary approach? So for example, their first offense, it might be being assigned the Healthy Futures course. Second time, it might be a Say What training module. Third time might be another level of education. Could you help clarify?
Yeah, that's a very good question. And I think a lot of people still have that question. The law reads pretty clear to us. It just comes right out and says any student caught with an e-cigarette must be sent or shall be sent to DAP, and shall, it doesn't say a tiered approach to that. So we read it as they must be sent to DAP, or if, like we said at the beginning, there's a capacity issue in school suspension. So the only thing we're sure of is that the law says may on education and support services, and we think that's where it should say shall. So we do think that should go along with it, but we don't really know. We're in communication with the Texas Education Agency and our advocacy groups who are trying to find out more about the nuances of the law, but as it reads right now, we're taking it as a direct referral to DAEP.
And is there discretion in the number of assigned days?
The law does not state the number of assigned days. We've heard various school districts that are already implementing this with the start of the school year, even prior to September 1st. And I've heard anywhere from 10 to 20 days for the DAEP placement, but it really, the law does not say any length of time for that placement or in-school suspension either.
Another question about HB 114 for you. Is there an age limit in regards to the bill? I am in elementary and had 5th grade students vaping last year.
Yeah, the law does not reference any grade level or age level of the student. It talks about any student in a public school being caught in possession on school property at a school event. So that would not, to me, indicate an age level. That this would apply to all children in the school system.
And what if it's a charter system? Does it still, we do not have DAEP, so is that expulsion?
We have gotten a little bit of clarification from the Texas Education Agency. They have posted, or we did ask that specific question about a charter school, and they stated to us that charter schools often follow the Texas Education Code for their direction, but they are, it is really dependent on their own policies and procedures and how they handle that situation. So it does, this law as written doesn't refer to the same codes that the charter schools are bound by law to follow. So it doesn't apply technically to charter schools.
So this next question is in regards to consent for students to participate in our program. So the question is, what does consent for students to participate in these programs look like? Is consent required to participate? I believe that's for you, Scott.
Oh, on my end, there is consent isn't required from Stanford side of things. I don't know the education code or law. I know that like there are certain things in each state that require, like if you're going to talk about comprehensive sex ed or some other things, that you're required to inform parent guardian and get either the parent permission or allow them to withdraw from that. But I don't know about tobacco or vaping specific.
For our end, for the Say What program, there isn't any consent that needs to be signed in order to participate. Even to complete any of our online training modules, anything like that, there's no consent that needs to be required or received from parents. So this next question is in regards to the PEMS reporting. Alan asks, I might have missed this, but does the law specifically state that we code the offense as DAEP even if we have to place the student in ISS?
I'm not a PEMS expert, so I would not know. That would be something we would have to ask about and get more specific. I do know that TEA posted a directive on their website recently. It was updated a statement on August 17th. And I'll just read it about what their direction is around PEMS data and the law. And it says regarding persistently dangerous schools identification and the impact of recent legislation. For the 2024-2025 school year, using PEMS data reported for the 2023-24 year, House Bill 3 and House Bill 114 respectively are described below, and the change in how these data are reported in PEMS will assist with a decrease in the number of mandatory expulsions. So yeah, I do not know mandatory disciplinary placements. It says that they may decrease in the number of mandatory expulsions for felony levels, which include marijuana or THC. It doesn't say specifically, and education now require mandatory DAE placement for these offenses. Additionally, this bill requires the student be placed in ISS when the appropriate administrator is assigning DAP placement for the above behaviors, but the DAEP is at capacity. So I don't know how you code that because I don't know PEMS that well, but it does say that in that directive, it does say that they go directly to DAEP. As far as some of the questions we have about the step up or all that, it doesn't seem like there's a choice of the school district not to send them to DAEP, but it does seem that at least now they're not going to be automatically coded as the persistently dangerous school.
The next question is about the programs that Stanford has in the Technical Safety Center. Is there a certificate available for proof of attendance offered? So I know for us with our online training modules, we, excuse me, we have certificates of attendance, but Scott, do you all include certificates of attendance or course completion certificates, anything like that?
So for the interventions for Healthy Futures, we absolutely have a certificate of completion for the students, because generally that's been assigned to them and they need to complete it in order to meet the rules or guidelines of their alternative to suspension or their placement. We do not currently have certificates for the other curriculum. It would be very easy to add, but because there are hundreds of thousands of students who participate sort of as a class versus independently, we don't currently have it set up to do certificates of completion. That would be easy if somebody said, I'd really like a certificate for my students. That would be really easy to add.
Are we able to share the recording with our school districts that were unable to participate? Yes, absolutely. Please share the recording. Please share the resources, everything with colleagues, coworkers, whoever you think would benefit from the recording and the resources. Also, more questions again about receiving the resources, whether or not they request it. Yes, you will automatically receive those. Melissa had, I think she missed the QR code or the link, but don't worry, Melissa, that's in Scott's slides. And you'll have access to Scott's slides. And he also just dropped the link. Is that correct? He just put the link in the chat for you. Just catching up on some more questions. Is there a self-paced parent intervention module for Stanford?
That's a great question. We do not currently have any self-paced interventions for parents. In part, we have educational information, but not a self-paced course that a parent would go through. There are some programs that are out there. I know that Catch and some other folks and PAVE have some parent ed modules, but I don't know as far as an official course. We don't currently have one. We have information, but not a course that they would take.
Okay. This is another question about the bill. I did not see this in the literature, Jennifer, but I may have overlooked it. Michelle says, I read in the bill that teachers and school resource officers can confiscate vapes and throw them away.
Yeah, I'm not aware of that. I've read the bill over and over. It's less than 2 pages, and I did not find that section. But if you want to send it our way, we can further research where that came from, or if it's in another bill. I'd love to see that. I did not read that in HB 114.
Okay. So I think with that, we have quite a few questions left that are going to require, I think, more thoughtful and in-depth responses. So we'd like to hold those for the Q&A document that we send out. We'll type it up and to be the easiest readable format possible. Just list the question and put your answer. And we'll even include the ones that we've already addressed. And again, it will go out to everybody, even those who registered and couldn't make it, because they will most likely watch the recording and have questions themselves. So we want to thank everybody so much for joining us today. We hope you found the resources and the information shared valuable. We hope you're able to get some clarification as to how you can move forward and progress. Of course, if the Technical Safety Center receives additional clarification on the bill, we will of course send that out and make sure that everybody is up to date and aware. But in the meantime, we want to give back a couple of minutes of your time today, and thank you so much for joining us. If you have questions in the meantime, before that document comes out, just contact us. We're happy to assist you, and have a great rest of your day.